A quick warning, this week we're discussing a sensitive and possible trigger topic about sexual assault. The care a person receives immediately following abuse or assault has a significant effect on their physical, emotional, and psychological well-being. St. Luke's has been leading the way and innovating clinical forensic care provided in Kansas City and the nation for 50 years. And here to explain is Jennifer Sonsiadek, nurse manager of St. Luke's Clinical Forensic Program. Thank you so much for being here.
Thanks for having me.
Of course. Okay, so St. Luke's is celebrating its 50th anniversary of its clinical forensics program. Can you share how it's been a leader in supporting caring for people in the community affected by sexual assault?
Yes, 1974 in August, St. Luke's Hospital of Kansas City opened their doors as the first private treatment center for those who have experienced sexual assault. And since that time, we have expanded our services for forensic care that would include obviously medications, evaluation of injury, documentation, photography, coordination with community resources for those who have experienced domestic violence, intimate partner violence, elder abuse, child abuse, human trafficking, and physical assault as well. And we are committed to providing education to our community to raise awareness of the impact of violence.
Really important education. Unfortunately, there are a lot of misconceptions about sexual assault. Can you kind of explain what some of those are?
I think some of the biggest misconceptions is that sexual assault happens by a stranger with a weapon, and that's not the case. More than 80% of folks who experience a sexual assault do so by somebody that they know, and it's an acquaintance or it's an intimate partner or a coworker, something along those lines. And the weapons that are used are not a gun or a knife. Typically, it's going to be a psychological weapon that instills fear or terror and confusion. And sometimes that weapon is alcohol or substances, where that's either voluntarily or involuntarily ingested and utilized to facilitate the assault.
Now, when a survivor does come in and see you, they receive a SANE exam. Some people may not know what that is. I know this is the first time of me hearing about it. Can you describe what that is?
Well, our nurses respond, and our first priority is the top worries and concerns of our patient. Sometimes that involves doing a sexual assault forensic evidentiary kit collection, and sometimes their concern is just addressing the medical concerns like exposure to disease and wanting to take prophylactic or preventative treatment, pregnancy concerns, safety concerns. So we'll address those first, and if they would like to discuss their statutory rights for Kansas and Missouri and all the resources that are available, we can walk them through that process. They can report or not report, totally up to them, and they can have a kit collected or not, and that just means that we're collecting what would be indicated based on what happened to them, and we will help them through that entire process.
Another piece of the process, too, is that they're going to see a specialized forensic nurse when they come see you. How important is that for that to be the case?
It's definitely a specialty. All of our nurses, they go through a 41-hour training and mentorship. It could be a nurse, it could be an advanced practice nurse or a physician's assistant, and there are some physicians. It's important because the way that the evidence is collected, the way it's packaged, we want to make sure that it is admissible into legal proceedings so that that person can have justice.
St. Luke's has expanded sort of the options available. If someone has been the victim of sexual assault, where can they go to receive treatment?
Obviously, the emergency department. We believe in extending the care where the person feels most comfortable receiving care. So that might be up in labor and delivery or OB or the ICU inpatient locations, as well as our clinic locations. So the urgent care, community clinics, physicians' offices.
Well, Jennifer, it's a tough topic, but such an important one that we discuss so that people can feel like they're seen out there and also have some options as well. So thank you for being here and sharing all this with us.
Oh, thanks for having me.
Of course. Hey, and for more information on St. Luke's Clinical Forensic Program, visit stlukeskc.org/clinical forensics or call 816-932-2000.